In today's video, we will talk about 13 warning signs that you may have cancer. Do not ignore them.
Are you worried about your health? Cancer is a disease that can develop silently, but your body often sends warning signs. The earlier you recognize these signs, the better your chances of successful treatment. Let's explore the key symptoms you should never ignore. First, let's talk about general symptoms that could indicate cancer, but may also be caused by other conditions. Unexplained weight loss. If you're losing weight rapidly without changes in diet or exercise, it could be a sign of various cancers, including stomach, lung, or pancreatic cancer. Persistent fatigue, feeling exhausted all the time, even with enough rest, can indicate blood cancers like leukemia or cancers that cause nutrient loss. Fever that won't go away. Recurring fevers can be an early sign of leukemia or lymphoma. Your skin can provide warning signs too. Watch out for new or changing moles. Sudden changes in color, shape, or size of moles may indicate melanoma. Sores that don't heal. If a sore takes longer than usual to heal, it could be a sign of skin cancer. Unusual bleeding or discharge. Blood in saliva, urine, or stool should never be ignored. If you notice any of these digestive or urinary symptoms, consult a doctor. Difficulty swallowing. Persistent trouble swallowing could be linked to esophageal or throat cancer. Chronic indigestion or stomach pain could be signs of stomach, esophageal, or pancreatic cancer. Blood in stool or urine may indicate colon, bladder, or kidney cancer. Changes in bowel habits. Persistent constipation or diarrhea without an obvious cause can be a red flag. Feeling a lump doesn't always mean cancer, but it's important to get it checked. Breast lumps or thickening can be an early sign of breast cancer in both men and women. Lumps in the neck, armpits, or groin may indicate lymphoma. Persistent swelling in joints or bones could be linked to bone cancer. Your lungs and throat can also send warning signals. Be aware of chronic cough or hoarseness. Lasting more than 3 weeks could indicate lung, throat, or thyroid cancer. Shortness of breath. If it occurs without exertion, it might be linked to lung cancer. Coughing up blood, a serious symptom that should never be ignored. Pain that won't go away can sometimes signal cancer. Chronic back or bone pain could indicate bone cancer or metastasis from another cancer. Pelvic pain may be related to ovarian or uterine cancer. Headaches that won't go away can sometimes be linked to brain tumors. Many of these symptoms can have non-cancerous causes, but if you experience them persistently, don't ignore them. Early detection saves lives. Stay informed, stay proactive, and always listen to your body.